Hi, my name is Silvia Karenina Hernandez Garcia, and today I'll be presenting the digestive system and esophagitis. The digestive system works like this. Food enters the mouth and starts being chewed by us as part of the mechanical digestion. It starts dissolving as well with saliva, which is produced by the salivary glands, an accessory organ of the digestive system. Saliva contains bactericides to stop bacteria, lubricant to have our mouth smooth, and salivary amylase, which helps hydrolyze starch to maltose, aka dissolved food. Now, we are going to call the chew food bolus. After we swallow, the bolus will go down the esophagus thanks to peristalsis movement until it reaches the stomach. Inside the stomach, the bolus will mix with the gastric juices and will turn into chyme. Then, the pylorus, surrounded by the sphincter muscle, will open when the process is done. It will allow the chyme pass now the 7-meter long small intestine, which has 3 parts: the duodenum, the jejunum, and the ileum. In the duodenum, which are the first 30 centimeters, the chyme will mix with the pancreatic juices produced by the pancreas, which is here, and bile produced by the liver and stored by the gallbladder, which are also accessory organs of the digestive system. This mixing of chemicals is called chemical digestion. We are going to call this new mix chyle, that have passed also through a process called lipase digestion. Lipase is an enzyme that hydrolyzes fats. The chyle will continue its way through the large intestine, this one, which measures approximately 160 centimeters and is divided by sections called colons. The chyle is affected by gut bacteria, which is essential in the intestine for a good digestion. The large intestine will absorb water and turn the chyle into feces. The feces will go all the way down to the rectum, which is this final part, and finally be expelled out of the body by the anus. The disease I was assigned to explain a bit was esophagitis, which consists on the inflammation of the esophagus mainly. It develops because of the retrocession of stomach acids to the esophagus, reflux, allergies, or sometimes even medicine. Their main symptoms are difficulty to swallow, pain when swallowing, pain in the chest, especially behind the breastbone, that occurs when eating swallowed food that gets stuck in the esophagus, acidity, and acid regulation. To prevent this disease, we need to avoid eating just before going to bed, smoking, or caffeine, chocolate, mint, and alcohol excess. It's a treatable disease, but the patient still needs to take care to avoid complications such as having a tear or a scar on the esophagus. Well, that's it. Thanks for your attention.